Leaders in essential industries are calling on the province to speed up and reprioritize phase 2 of Ontario's vaccine rollout. It's the stage where frontline other high-risk workers like teachers, retail employees, and those in the manufacturing sector will be eligible to get shots. As Jason Gaidola tells us, the Ford government announced a new leader to its task force, and questions remain on when the move will happen as cases surge.
According to Toronto Dr. Abdu Sharkawi, a healthy 47-year-old teacher is fighting off COVID-19 while intubated in ICU. He is one of many other physicians wondering why someone like a teacher hasn't been vaccinated yet.
It's essential workers. People are younger, people are getting sicker, they're getting admitted to the ICU, and many are dying.
As hospitals continue to see record highs of ICU admissions, palliative care physician and health justice advocate Dr. Nahid Dasani says now is the time to put in place a new plan for vaccination prioritization for younger workers in schools and other high-risk exposure jobs.
We're seeing across the province many examples of places where vaccine slots are going empty. With nearly 1 million COVID-19 vaccine doses sitting in freezers, we are seeing an increased supply become more available.
The province is once again telling CHCH News, to be clear, vaccines are not sitting in freezers. Every single vaccine dose received has been allocated to a waiting Ontarian who has booked an appointment. The Ford government announced that CEO of Orange Air Ambulance, Dr. Homer Tian, will replace retired General Rick Hillier and lead operations of the distribution task force. Frontline workers are slated to be included in the second phase of vaccinations, but no official date has been set yet. The province says it could begin as early as this month or as late as July, depending on supply from Ottawa. According to the province, there are currently 716 active outbreaks here in Ontario, and roughly 35% of them are in the education sector.
The reason we're looking at closing schools last and opening schools first is because we are recognizing the significant impact a lockdown and a shift to remote has on families, on students' mental health and well-being. And if our priority is to keep schools open, we have to be vaccinating our education worker staff.
Hamilton Wentworth District School Board Chair Don Danko says staff absenteeism has dramatically climbed over the last month.
And you've seen a number of schools, ours, Dr. Davey, had to go to remote for 2 weeks because we didn't have enough staff to cover the absences in that school related to, regular absenteeism, related to sick leave, but really a lot of those cases that we couldn't fill were related to absences due to COVID.
Currently in Hamilton, there are 15 active outbreaks in schools and childcare, with roughly half linked to variants. On Thursday last week, Ontario's Education Minister Stephen Lecce said schools will remain open, tweeting that they are critical for mental health and learning. Dr. Brown from the Ontario Science Table added that schools should be the last thing to close.